So, it's quite obvious from, if you've seen my videos before, that I don't like quacks. However, it's an entirely different point when quacks entirely misrepresent studies, actual scientific studies, to promote their own woo-woo. And we have one here. And the headline of the study says, sorry, that was a bit confusing. Study shows that light therapy is more effective than Prozac for treating depression. That is the title of the article. And the author begins, in most cases what is misdiagnosed for clinical depression is actually dissatisfaction with one's own personal space and environment, and sometimes factors that people don't even notice play a major role in the state of mind. One major factor is that many people miss is light, which actually plays a critical role in how we think, feel about our daily life. In fact, light is so important that millions of people suffer from a condition called seasonal depression, in which they become sad when the days are shorter, darker and more dreary. On some level, everyone is psychologically affected by their access to light, whether they realise it or not. For many years, light therapy was used especially for people who experience seasonal depression, but now researchers are attempting to try this therapy for general depression and other related issues. No, they were just trying it for depression. In a recent study, it was actually discovered, this is what this guy is claiming in this article, it was actually discovered that light therapy was more effective than Prozac in treating depression. Right. And in the thing, he says, according to study, has a link to the actual study, and then he quotes the study. Right? And in it, he has an actual bit of, I was really dishonest, he combines the objective part with a couple of other sections to make it look like what he's saying is true, but actually it's not what the study said at all. Again, I'll leave a link to the article, and I'll also leave a link to the study as well, so you can see for yourself. And basically, the study itself, they looked at how light therapy, in combination with phloxine hydrochloride, which is what they use in antidepressant medicine. That was what the objective of the study was. And they compared it with a sham placebo. So people got the phloxide hydrochloride, or we'll call it the phlox. Some people got the placebo. What happened to the people who received the placebo? Well, it didn't work. In fact, when you actually read the conclusion here, it says that bright light therapy, both with monotherapy and in combination with phloxide, was effective and well tolerated in treatment with adults and non-seasonal MDD. The combination treatment had the most consistent effects. So here you have the actual study that says when you use light therapy in place of, well, when you use light therapy and the phlox together, they work. You actually get results, and consistent results. When they didn't get anything, or they didn't get results at all. And yet, if you read this article, again, after he basically just leaves this quote, he then goes on to start saying, in the study they talk about phloxide, and they are speaking of an active ingredient in the popular antidepressant Prozac, and basically he goes on to demolish Prozac and how people are put on too much medication. But if you actually read the study, when they did this study in combination with light therapy and giving people the Floxarite, it worked. It did a lot better than the light therapy by itself. So that is not what the study is saying, but it's what this article is saying, is claiming the study says. And this is an absolute misrepresentation of the study itself. So, again, I am absolutely flabbergasted that this website, Truth Activist, would actually let this fly. So, yeah. There you go.